Hello, my name is Rocío Sandoval. I'm going to talk about topic number 16, fibrosis. Fibrosis definition is a managed disease multi-sense autosomal recessive either reflection of the entire gland secretion. Results of mutation localized on the gland are of chromosome 7 gene.
Hi, my name is Felix, and I have cystic fibrosis.
Hi, my name is Fiona, and I have cystic fibrosis.
Hi, Charlie!
What is cystic fibrosis?
Cystic fibrosis, or CF, is a genetic disease. That means we're born with it. When we are born, our genes determine our eye color, hair color, and if we look like mom or dad.
A defective gene causes our bodies to create a really thick mucus that covers our internal organs, especially our lungs, making it hard for them to work correctly.
Is it only you two who have CF?
No, there are 30,000 people across the country and 70,000 worldwide who have CF.
What happens to you when you have cystic fibrosis?
Because the mucus is covering our lungs, it makes it hard for us to breathe. We can do everything you can do, it just takes us so much more energy.
Can you give your CF to someone else?
No, cystic fibrosis is not contagious. You either have it when you're born or you don't.
You don't look like you have a disease.
On the outside, we look like all of you. But on the inside, our organs are working overtime, all the time, just to function properly.
How else is your body different because you have cystic fibrosis?
Well, we have to be very careful not to get sick. When you get sick, you might be in bed for a few days. When we get sick, we can end up in the hospital.
The mucus inside our bodies holds on to the germs and bacteria, making it very hard to get better. Sometimes we can be in the hospital for months.
Is there something you can do to stay healthy?
We try to keep our lungs as clear of the mucus as possible.
We do this by putting on a special vest several times a day that shakes us to loosen the mucus.
So we can then cough it up and spit it out.
To keep healthy, we also have to take medicine every day. Lots of medicine. On average, we have to take 40 to 60 pills a day. That's 350 pills a week, and 1,500 a month, and 18,000 a year.
If you were to stack a year's worth of pills end to end, they would reach 750 feet tall. That's more than halfway up the Empire State Building.
Wow, that's a lot of pills. How can we cure cystic fibrosis?
Right now, there is no cure, but scientists are working hard every day to find one.
And there are lots of people who are helping by donating money so the scientists can keep looking for the cure. But for now, every time you blow out a candle
or wish upon a star, it's for one thing.
A cure for cystic fibrosis.
Affects. In producing a protein or other membranes affects the lungs, pancreas, liver, and reproductive apparatus, chronic evaluation, progressive disability, and daily variability.
Cystic fibrosis is a genetic disease that alters the body's respiratory, digestive, and reproductive systems. It affects the body's epithelial cells that comprise the lining of the lungs, pancreas, liver, sweat glands, digestive tract, and reproductive system. Normally, the epithelial cells release a slippery layer of mucus, captures dust and germs, and acts as a lubricant. A person with cystic fibrosis inherited a gene that causes the epithelial cells to produce a defective protein. That protein leads to the formation of thick, sticky mucus, which causes many serious problems. The sticky mucus can clog the bronchial tubes, interfere with breathing, causing coughing and wheezing, cause fatigue, interfere with digestion and absorption of nutrients, which can limit growth and weight gain and cause chronic diarrhea. Common symptoms of cystic fibrosis include persistent coughing, poor weight gain, bulky stools, and very salty tasting skin in infants. Treatment of cystic fibrosis varies according to the stage of the disease and which organs are affected.
Application of medicine. There is called for cystic fibrosis, however, look affection are treated with antibiotics. It can be administered intravenously, inhaled, or removed. For example, the antibiotic resistance is used long-term, inhaled in hypertonic sinus and salbutamol.
Cystic fibrosis is a disease passed down through families that causes thick, sticky mucus to build up in the lungs, digestive tract, and other areas of the body. It is one of the most common chronic lung diseases in children and young adults. It is a life-threatening disorder. Cystic fibrosis symptoms. Symptoms in newborns may include delayed growth, failure to gain weight normally during childhood, no bowel movements at first 24 to 48 hours of life, salty tasting skin. Symptoms related to bowel function may include belly pain from severe constipation, increased gas, bloating, or a belly that appears swollen, distended, nausea and loss of appetite, stools that are pale or clay-colored, foul-smelling, have mucus, or that float, weight loss, Symptoms related to the lungs and sinuses may include coughing or increased mucus in the sinuses or lungs, fatigue, nasal congestion caused by nasal polyps, recurrent episodes of pneumonia. Symptoms in someone with cystic fibrosis include fever, increased coughing, increased shortness of breath, loss of appetite, more sputum, sinus pain or pressure caused by infection or polyps. Symptoms that may be noticed later in life: infertility in men, repeated inflammation of the pancreas, pancreatitis. Respiratory symptoms, cystic fibrosis treatment. An early diagnosis of CF and a comprehensive treatment plan can improve both survival and quality of life. Follow-up and monitoring are very important. If possible, patients should be cared for at cystic fibrosis specialty clinics, which can be found in many communities. When children reach adulthood, they should transfer to a cystic fibrosis specialty center for adults. Treatment for lung problems includes antibiotics to prevent and treat lung and sinus infections. They may be taken by mouth or given in the veins or by breathing treatments. People with cystic fibrosis may take antibiotics only when needed or all the time. Doses are usually higher than normal. Inhaled medicines to help open the airways. DNase enzyme therapy to thin mucus and make it easier to cough up. High concentration of salt solutions, hyperchloroxylene. Flu vaccine and pneumococcal polysaccharide vaccine, PPV, yearly. Ask your healthcare provider. Lung transplant is an option in some cases. Oxygen therapy may be needed as lung disease gets worse. Lung problems are also treated with aerobic exercise or other therapies to thin the mucus and make it easier to cough up out of the lungs. These include a percussion vest, manual chest percussion, a cappella, or therapeutic device. Treatment for bowel and nutritional problems may include a special diet high in protein and calories for older children and adults, pancreatic enzymes to help absorb fats and protein, vitamin supplements, especially vitamins A, D, E, and K. Your doctor can suggest other treatments if you have very hard stools. Care and monitoring at home should include avoiding smoke, dust, dirt, fumes, household chemicals, fireplace smoke, and mold or mildew, clearing or bringing up mucus or secretions from the airways. This must be done 1 to 4 times each day. Patients, families, and caregivers must learn about doing chest percussion and postural drainage to help keep the airways clear. Drinking plenty of fluids. This is particularly true for infants, children, in hot weather, when there is diarrhea or loose stools, or during extra physical activity. Exercising 2 or 3 times each week. Swimming, jogging, and cycling are good options. Cystic fibrosis is a common disease, yet every individual needs unique treatment and care. We encourage people with cystic fibrosis and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about cystic fibrosis and how to treat cystic fibrosis, just click on the link at description or visit www.mainnd.com. Thank you.
Application medicine has a long-term application might be an option if lung function continues to worsen. Pancreas enzymes represent soluble vitamin supplementation are important, especially in the young. Will not we support with events? Many people use airways clearance techniques such as physiotherapy. Pros and cons. Cystic fibrosis is a rare disease and can be fatal. The genetic disease is more frequent in the wild race. The presence and severe pathology have more early diagnosis and proper treatment can reduce its effects. Incidence and place in Ecuador. Regarding the impact on Ecuador, the specialist indicated that varies with region. In general, in Ecuador, the incidence is 1 in 10 points in having. Three foundations dedicated to combating cystic fibrosis research and grants of $5,000. The beneficiaries are the patients on the Cystic Fibrosis Foundation Ecuador, has Quito, Guayaquil, and Cuenca. Conclusion. Cystic fibrosis is genetic disease. People are for this reason it cannot be forever. Unlike its grown-up that parents are carried. It demonstrates the direct line between early diagnosis and the development of better quality of life and patients. Therefore, show that early treatment helps the patient to have a better quality and life expectancy. To achieve these people have to provide robust environment with control risk capacity, balance of fat groups.
Our next topic is cystic fibrosis. This is one you're going to get asked, pretty much guaranteed. It's on the long arm of chromosome 7. It's an autosomal recessive disease. That's one way they can ask you what chromosome it's on. They can ask you right away, patients with cystic fibrosis, what are the chances of having another affected child? You have to know that it's autosomal recessive. That means that the parents have a 1 in 4 chance of having another affected child. The gene is the CFTR gene. It's a transmembrane regulator. It has a lot to do with ion shifts. There are a lot of other genes. This is the most common one, and we can't test for all the mutations. Although we do have blood tests for cystic fibrosis, we can't test for all the mutations. So the best test, what does that sound like a test question, is going to be a sweat chloride. Okay? These babies will have chronic airway obstruction. They can have malabsorption, and they can have failure to thrive. They can have a myriad of manifestations. It's a multi-organ disease. They fail to clear out mucus secretions. The old term for cystic fibrosis was pulmonary mucoviscidosis, and that was the description of the secretions. They were very thick mucoid secretions. They're hard to cough up. They can lead to infections. They can lead to atelectasis and pneumonias. They also have a low water content in their secretions, and the sweat has an increased chloride content or salt content, and that's why that test is such a good diagnostic test. They will, most of them will have pulmonary pathology. Some patients present with GI pathology. Those tend to do a little bit better, but most patients will have some kind of respiratory pulmonary pathology. They don't do as well. Other things that you can find, polyps. Okay? Look for that on the exam. They love to throw that in, nasal polyps. Okay? They can also have some pancreatic dysfunction. Some patients will develop diabetes mellitus, and because of pancreatic dysfunction, some patients, because of exocrine pancreatic dysfunction, they can develop malabsorption. They can also have, rarely, biliary cirrhosis. The males tend to be sterile. Depending on the age, depends on how they present. In the newborn period, the most common presentation will be meconium ileus. So there is a plug of meconium that sits there, and it prevents the stools that tend to float in the toilet. They can actually have rectal prolapse. They also have vitamin deficiency, and this leads to malnutrition problems. This is a rectal prolapse. Other disease entities can cause rectal prolapse. The other thing that you can notice in this child, besides the rectal prolapse, is the lack of subcutaneous fat. Particularly look at the buttocks. Okay? This is from malnourishment and malabsorption. These things you can see, probably a little bit short, so they can have failure to thrive. And look at this boy's chest. Okay? They have an increased anteroposterior diameter, a lot of times just from chronic air trapping, clubbing of the fingers and toes because of chronic hypoxia, as opposed to when we talk about asthma. You can hear expiratory wheezes, and they will have cyanosis. The males are sterile for the most part. They can also have cryptorchidism. Females also have decreased fertility. Look closely. Many times, parents might tell you that the baby tastes salty when they kiss him or her. So these babies may have chronic, persistent pneumonias, and they're always coughing as an infant, and the parents will say, you know, doctor, when I kiss the baby, you just take that child has cystic fibrosis till proven otherwise. You can try getting the blood test for the gene. If it's positive, you have an answer. If not, you wait till they're a little bit older, a few months, do the sweat chloride, you have the answer. These patients get very quickly colonized in the lungs with staph and with Pseudomonas. Chest x-ray shows hyperinflation, infiltrates, atelectasis. I'll show you an x-ray in a second. When patients are old enough to do pulmonary function testing, you will see that they have obstructive disease. And again, Staph aureus and then Pseudomonas commonly affect the airway. So here we have an x-ray, typical x-ray for cystic fibrosis. On this side over here, you can see air trapping. You see how far down this diaphragm is, and you can count a ton of ribs. So there's air trapping here. There's some chronic changes of atelectasis and bronchiectasis, and pneumonias here, and there's some stuff over here on the left hilar area. Typical x-ray of cystic fibrosis.